Yes.
Yes. Yes. Good afternoon. I am participating to this conference from the mechanical and engineering part of the conference, and so it is different from educational basis and the social part. But I'm going to explain about the COVID risk on humans and office spaces. And I'm an architect, and I am working 35 years of experience in architecture, and also assistant prof in the University Rauf Denktas University in North Cyprus. Like 25 years of experience in architecture, department of architecture. Now we have also Onuralp project management firm about project management projects, and in the pandemic outbreak into 2020. One of our clients, European Support Office, came to me and asked about what we are going to do about this COVID problem. So, from March 2020, we have COVID outbreak in North Cyprus, and because of this reason, this project should be prepared urgently in that time. But we have some problems in that time. In 2020, we have not enough data, enough knowledge what we are going to do against COVID spread in interior offices or interior spaces. So in that time, I take the responsibility and initiative behalf of my team, and then after the big research about these ventilation theories, we find out that displacement ventilation theory is very close to our aim to get rid of COVID viruses in the office spaces, to clean the office spaces from COVID viruses. So my client asked from also a sample of a guarantee to have 100% risk, to have 100% removal of COVID spread in the spaces. So European Support Office, EUPSO, is a organization that supports the projects for Turkish community in North Cyprus. And I have done also before in 2016 their refurbishment project and their project for internal space design. So we have 260 square meters every floor, and we have also we have 5-story building, and we have also a ground floor. Ground floor we have we have also the conference rooms and the entrance. So this building is also renovated from a residential building, and we convert this residential building to an office building. In May 2020, we start designing our project, and we clearly come to a point to have our layouts of our project. According to our research, we see that before the COVID outbreak, we have a ventilation system or mixed ventilation system, and because of this mixed ventilation system, we have been living problems nowadays also, because the ventilation mixing the air inside the space, and when it mix, it gives too much danger to the people inside the building. Now I am going to pass to the building. You want to show the building to us first of all, from the bottom. Yes, we are in Cyprus. This is our Cyprus in the East Mediterranean Sea, and the office building is Nicosia. Nicosia is the capital city of the Cyprus, and we have also this type of border. You know, we have two sides, south and north sides. North side is belong to the Turks. South side belong to the Greeks. And this is the walled Nicosia, and our building is close to here. Okay, and this is our building. And this is the plan, this is the site plan of our building. This is the road. On the road goes to the north. And this is our building that's going to be projected for ventilation. So this is, I prepared this paper for the guests to show that this is the architectural aspect of ventilation system from the beginning, and the drawings are like the architectural drawings. Details are architectural details, and everything is differently handled. So in the ground floor, we have our conference room, and we have the ventilation, fresh air ventilation and exhaust ventilation pipes, and two pipes. So in this project, we have different interpretation of the ventilation, that we are taking fresh atmospheric air inside, and we are taking the polluted air from the inside of the space to the outer space. So we have two pipes. One is fresh air, the blue ones, and these are the violet ones. Which are the exhaust airs. So the machineries are at the top, and remove the air from the building. And every floor we have this type of not long pipes that take the pipes continued at the ceiling. They are short pipes, which is more efficiently. So the problem is here that we are doing this business while the building in use. Building is in use, and we are now implement a project of ventilation here. So for our ventilation scientific outline, if you can understand the project simply, I think, and we can come to what's the problem in front of us. The first problem is can ventilation system spread the COVID virus inside the building? So we should take precautions about the ventilation system and we keep this danger like that. Here you see these pipes can also take the droplets, nuclei of the viruses between the spaces. So this also taken in account, and we have also precautions about that. So we select displacement ventilation. So what is the displacement ventilation? The other thing is that we should know the particles of our dangerous effects. So one is the viruses, gas molecules, tobacco smoke. These are particles, airborne particles, bacteria, pollen, and these are dangerous effects. So we should use also a filter that filter this type very high developed filters, HEPA filter to our in front of the fresh air in canals, and to filter the air, atmospheric air very clean, to create a clean air inside our building. So we take out the mixed ventilation theory out, and we put our displacement ventilation theory. What is the displacement theory? This, for example, a sample of a restaurant which has mixed ventilation. So when mixed ventilation means you give the air from the same point and you take the air from the same point, and this creates this turbulence in the space like that, and which this turbulence create a mixing the air in, and all the users here can be affected by the viruses. So after this pandemic, so the theory of the ventilations changes, and maybe we are going to give up mixing ventilation, like that mixing ventilation. We give the air from the same place, mixing the air inside the building, and left this type of ventilation, and we are going to displacement ventilation, like we are giving the air from the bottom of the space, and our convection plume make the air to go out, to go up to the ceiling to create a stratification level, and hot air contaminant mixing at the top, and this will go through the exhaust fan, exhaust canal to the outside of our building. So this is our scientific base of our project. So according to determinations, what are the climatic conditions of our Cyprus? Cyprus is a very hot country, like 45 degrees in summer, and we have also 30, 34, 35, and 45 between these. So the climatization, the incident is so important too. So we should also cool the air in, the atmospheric air in, a little bit to come to a 25 degrees as a comfortable level of degrees in the inner space. So we are also cooling the air that come inside the building. So here, as you see, we have the displacement ventilation. So displacement ventilation is inlet from here and outlet from here. So I come to, I want to give briefly because we have a limited time, and so what are the results of our project? So the project is computer-aided designed. So indoor air quality estimations are all have been done computer-aided, and all this also calculations are made in computer-aided design. So I come to to So our ventilation theory is an application and interpretation of displacement ventilation. We put the fresh air in, as I expressed, and evacuated the polluted air. So the exhaust vents will be the top of this ceiling, and also we have the fresh air new creature. So we created for fresh air to put them down and slowly in. I created different type of vents. So this is gooseneck type vent. So this is the new terminology in our project. So it is gooseneck type. So vents, and we have also down vent type vents in our design. In our design, we have some results, and results are that this building should be, all the system will be implemented outside of the building, and some part is the inside the building. So because the buildings are in the usage, their building are occupied, they are using the building, and we are putting the vertical ducts on the facade of the building and the horizontal ducts in the inside the building, suspending them under the existing ceiling. We should also design inside very elegant according to these pipes, and give a good internal views to get good also scenery. For example, here, as you see in two examples, one is the office spaces. As an architect, I put the exhaust pipe here on the top of the people of office usage, as people is sitting here in the desk and taking extraction of the air, polluted air at the top of the people, that the exhaled air from the mouth of the user can go spread into the space and can rapidly exhausted from the top. Like in this building, this space, this is a meeting area. We also have extraction of the air from the middle of the space, and we have, as you see here, we have air gooseneck type of canals here, and we are giving the fresh air very close to the wall and down with the down pipes like that. So we separate the inlet and outlet far from each other. For example, this is a conference room. So these are the exhaust fans, and this is at the top of the ceiling, and these are the fresh air in. This is the pipes that go down like 1 meter from the floor level and give the air to the floor level and extract from the top. Different type of ventilation system. So these are the calculations, or the pressure calculations of our project for the pressure, how we are going to pressurize the canals to stop the inside the canals, the contaminated air to pass from one office to another office, to have a pressure in the canal. And then we this is the calculations of our volumes of the spaces, and this is the machinery at the top. And as you see, we have nothing regulated air. We have fresh air in and full fresh air in, atmospheric air, and we have the polluted air directly goes out space from our building. So as we come to the conclusion, my dear guests, we come to a conclusion that In that time, we really have a very limited scientific data about the COVID spread. In that time, there are a lot of unknown parameters for designing and creating COVID-free space for office building. As an architect, as a project manager, we took initiative to and responsibility to design this project from concept to the contract, technical specification, and tendering document project stages. So, and this example show us that this COVID pandemic give us very important effect on ventilation. This is the result that we should always use clean, not clean the air. We should use atmospheric air, clean atmospheric air, and we take the polluted air directly from our space, and we put the atmospheric clean air, which is filtered by HEPA filter, and take the air and refresh the spaces with fresh atmospheric air. Before this outbreak of COVID-19, we are cleaning the same air. For example, we take the air from the space, we cleaning and put the same air in. But now it is very dangerous, and this shows us that we should put the new air in to our spaces. I want to emphasize this with my paper, and I'm really thankful for you for listening to me, and thank you for your time.